Osteogenic imperfecta. Osteogenic imperfecta is a genetic disorder of connective tissues caused by abnormality in the synthesis of or processing of type 1 collagen. It is also known as brittle bone disease, which is characterized by increased susceptibility of bone fractures and decreased bone densities. Other manifestations include blue sclera, Osteogenesis imperfecta, short stature, as well as deafness in adulthood. Also, there are severe forms of presenting with crumpled ribs, fragile cranium, long bone fractures, result in increased perinatal mortality. Characteristics of osteogenic imperfecta is 3 features are there which are known as osteogenesis triad. These are blue sclera, deafness, and recurrent fractures. Can also be remembered by mnemonic BIRD, BRD. B here is blue sclera, R is recurrent fractures, and D is the deafness. Now, diagnosis is made by taking clinically or family history and bone mineral density, especially for the lumbar vertebra. Bone biochemistries are performed and radiographic features are ruled out for the bone structures. Now, treatment part include treatment varies according to the age, severity of the symptoms, and functional status of the patient. Mild disease require subtle restriction, avoid contact sports, and treatment of any fracture if it is present. Moderate to severe disease include rehabilitation, orthopedic interventions, management of acute fractures and scoliosis. When there are severe disease, then an intramedullary rod with osteotomy used to correct severe bowing of legs. Medical management include earlier we used to give calcium, calcitonin, vitamin C, D, magnesium oxide, sodium fluoride, but they are resulted in of no use. Nowadays, treatment guidelines are changed. Biphosphates are given, which can be given IV and orally. IV biphosphates are IV biphosphates is pamidronate and orally is LD-dronate. Have been demonstrated useful to decrease the risk of fractures and improving the bone mineral density as well as ambulatory status. Now, in rehabilitation methods, depending upon the disability, deformity, we give orthosis, walking aids, and wheelchair to the patient. And if there is long bone fracture, then its management and deformities are corrected by surgeries, which are closed osteoclasis or closed osteoclasis with percutaneous intramedullary fixation, and third one is open osteotomy with internal fixation is done. Thank you.